My people, you know, my people, well done. My name is Dr. Toyin. Today we go discuss hay fever. Hay fever dey happen when some people get allergy to plant pollen, and when dem put am inside their body, dem go come get swelling of the airways. All of this go come produce these things. One, dem go dey sneeze well well. Two, dem go get blocked nose. Three, dem go get clear water from their nose and their eyes. Four, their eyes, their nose, their throat go dey scratch dem. Five, e get some people when dem go chop raw fruit and vegetable like apple, when their throat go dey scratch dem. Na because dem get allergy to tree pollen, and dem dey call this one oral allergy syndrome. 6, because of all these things, some people no go dey sleep well, and because dem no dey sleep well, dem no go fit work well. 7, some people fit not even comot house during this time. Now, wetin be the treatment for hay fever? 1, you go try to avoid contact with the pollen, and you fit do this by make you no dey comot early morning or evening, because na this time na im pollen dey plenty pass. If you dey inside car, make you roll up the window. Your window for bedroom, make you no open am early morning or evening. If you open the window during the day, make sure say you put your pillow under your blanket. If to say you go outside, make you wear glasses so that e go protect your eyes. If you come from outside, make you change your cloth, make you wash your face so that e go comot all the pollen. Make you put Vaseline near your eye, near your nose, so that this one go dey trap the pollen, make e no enter your eye and your nose. 2, you fit take medicine for this hay fever, but this medicine you need to take am 1 month before all this thing go start. The medicine na wetin dem dey call antihistamine, and e fit get tablet, the one wey go make you sleep and the one wey no go make you sleep. You fit get antihistamine eye drop too. You fit get steroid nose spray. Make you try make you no dey use wetin dem dey call nasal decongestant. Na because if you stop to use am, your nose go block again, and you no suppose use am pass 5 days. 3, if to say the disease serious well well, make you go meet your health professional, because dem fit give you wetin dem dey call disease altering immunotherapy. I hope say you don know more about treatment of hay fever. And until next time, smile because e dey healthy. Bye bye you.